po tayo, usually nangyayari po yan sa motor vehicular accidents, na? Ayan, a lot of this talaga is of course na nangyayari po talaga, lalo na yung mga agonal gasp, na very obvious po. They're trying to gasp na for air, but then again, this patient is already unconscious. Na? So you better start with your high quality chest compression. Mamaya na po yung stop po natin kasi more of start muna tayo. Okay? And so to begin with, as we all know, your CPR kasi, your high quality chest compression is an aerosol generating procedure. With aerosol generating procedure kasi air po, no, as high as 10 inches. Lalo na pag nag-compress po tayo. So as you compress the client, bigla pong madi-disperse ang viruses na 10 inches from client. So pag ikaw din, nakaharap ka kay client mo, tapos without proper PPE, then you can actually harbor nawaka. So ang tawag doon, it's an aerosol generating procedure. Ano pa ba yung mga examples ng aerosol generating procedure? So aside from the high quality chest compression, if you're familiar with intubation, for sure, na an intubation also is an aerosol generating procedure. Ano pa? If you use the bag, the BVM, na if gagamit po tayo ng BVM, di ba, the bag, the valve, and the mask. Sorry, ba't parang wala yung screen recording? Ayun. Oh, guys, paano na lang? If may nag-a-appear po sa mga screen nyo na na recording, i-press nyo lang yan para at least maka-continue po tayo. Or else maghahang po yung mga gadgets nyo po. So with BSI stands for the Body Substance Isolation Equipment po natin. So pag sinabi po nating BSI, also known as the PPEs po natin, ha? And the PPEs, or the PPDs. When we say, PPEs, these are the personal protective equipment, or the PPD, known as the personal protective devices po natin. Okay po? Ano ba yung mga example po ng PPEs at saka ng mga PPDs po natin? As you can see, now we have the number 1, we have the mga N95 po natin, may mga gloves po tayo, may mga face shield po tayo, na may mga goggles din po tayo. Ang tawag doon, PPEs or the PPDs po natin. So as you can see, may mga BSI po tayo, the body substance isolation, also known as the PPEs, also known as the PPDs po natin. So, nawala yung slide. Wait lang ha. Wait lang po. Okay, so we have the BSI, the body substance isolation, we have the PPEs, and then we have the PPDs. So again po, as emphasized by your American Heart Association, you need to have a full PPE po dapat na before mag-start ka ng BLS, especially pag nasa hospital setting po tayo. Pero pag outside or pre-hospital setting naman, no need to have your, let's say, full PPE. Lalo na if gusto mo lang namang makatulong talaga. Pero may mga technique po tayo ngayon, guys. Lalo na if you're going to tap the shoulder. Guys, pawala-wala po yung internet po natin. Sorry ha. Feeling ko nare-reset naman to eh. Sige lang po. I need your full patience na din po. Okay. So we have the BSI, the PPDs or the PPEs po natin. So ayun, let's discuss po the principles of high quality chest compression. Hello, can you still follow pa? I guess my slide is not moving po. For a while lang ha. Hello? Guys, can you hear me ba?
Yes po.
Miss Cindy
Yes po.
Rosales.
Yes po.
Okay. Medyo ano lang.
Yes po.
Okay. So let's discuss po the principles of high quality chest compression. Now with our principles of high quality chest compression, so again guys, no, ang proper term dapat nagagamitin po natin will be the high quality CPR. So pag sinabi po nating high quality CPR, it's the high quality P, letter U, letter C, and then we have your letter H po natin. So letter P stands for, we need to push hard, and then we need to push fast then. So upon pushing harder and faster, we need to follow a rate of 100 to 120 compressions per minute po. So this is based on the American Heart Association. Now, aside from pushing it harder and pushing it faster of a rate of 100 to 120 compressions per minute, so letter U stands for unnecessary. Ayan, interruptions. Unnecessary interruptions, okay, must be minimized. Must be, ayan, minimized to not more than 10 seconds. To not more than, ayan, more than 10 seconds po. Sige nga, everybody say 10 seconds. Para ma-check ko lang din po yung internet po natin at kung nagkakarinigan ba talaga tayo.
10 seconds.
10 seconds.
Ayan, thank you so much. Thank you so much. So again, we need to push hard and faster at a rate of 100 to 120 compressions per minute. Next, unnecessary interruptions must be minimized to not more than 10 seconds. Now, how do we count for seconds ba? We usually count for seconds like this. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 10, 1,000. Na 7, 8, 9, 10, 1,000. Dapat ganun mag-count ng seconds po. Or, pwede rin ganito, Mississippi counting. 1 Mississippi, 2 Mississippi, 3 Mississippi, and then 4 Mississippi up to what? Na 10 Mississippi. Na that's your 10 seconds. However, kasi ayan, na so 10 seconds po. So others kasi na ganito kasi ang turo ng iba ng mga training centers, 1,001, 1,002. Mali po 'yon. So it should be 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, up to 10, 1,000. Kaso, in-emphasize po ng American Heart, sir, pag not more than, okay, 10 seconds. So, meaning, maximum na po yung 10 seconds po natin. In American Heart Association, ganito ang turo po. It should be 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, up to 5, 1,000 only. Okay po? So, again, wag na pong lumagpas na ng 5,000 or let's say 5 na ayan 5 1,000 kasi ayan sobra na po tayo na kasi ang limit lang kasi not more than 10 seconds. So again, if we're going to check for pulses, if we're going to check na sa ating breathing dapat sabay 1 1,000 2 1,000 3 1,000 4 1,000 5 1,000. The patient is not breathing and has no pulse. So therefore, we are going to start now with our high quality chest compression. Next, letter C stands for compression deafness. Compression. Ayan. Pag sinabi natin So we have an adult client. Next to an adult client, guys, we have a child na patient po natin. Next, we have the infant patient. Now, pag adult kasi yan, it's 8 years old and above. Based on American Heart po ha, 8 years old and above, considered as an adult client. Next, pag child naman po, pag 1 year old up to 8 years old, child po yan. Pag infant naman guys, it's 1 month up to 12 months old. So ito po yung bracketing po natin. Now, in order for us to identify na that's okay, our real patient po. Kasi some of us na medyo nalilito, ano ba to, child ba to or infant? Na? Ano ba to, sir? Child ba to or adult? Guys, if you think na mas malaki pa po yung child na sa'yo, so you're going to use your both hands po dapat. Pero if you think na mas malaki ka pa rin sa batang yan, you need to make use of one hand. Kasi lalo na pag na-assign ka sa States, di ba? Ang lalaki kasi ng mga bata doon, Diyos ko. Na i-compare mo naman sa the usual na mga Asians, compared mo naman sa mga Caucasians talaga, so mas malalaki nga talaga sila. So, pag ikaw Pinoy, tapos magko-compress ka ng child na mas malaki pa sa'yo, you need to make use of your both hands po dapat. Kasi 'di ba, ideally for an adult kasi both hands kasi yan. Tapos pag child naman po, one hand technique. Pag infant naman, two fingers technique po tayo. Either two fingers or the thumb encircling technique po. You're going to wrap it na around the chest of an infant po. So may mga videos po tayo later. We will be talking also more of aspiration din later. May mga videos po tayo. Yeah, the airway management, madi-discuss din po sila. Okay, let's discuss the compression deafness of an adult client. Now, what do you think is the best pulse to check here? Are you aware na we are still using the 30:2? 30 is referring to compressions, while 2 is referring to what? No, full breaths po natin. So we have full breaths. Now, sir, ilang cycles ba yan? A total of 5 cycles. Now, are you aware na ang 30:2 po natin, guys, 30 compressions plus your 2 full breaths or ventilation, a total of 5 cycles. Ayan, this should be performed for at least 2 minutes. Para makuha daw natin yung 100 to 120 compressions per minute, guys, ayan, it should be at least 2 minutes po. All in na po yan. Now, with adult kasi, how deep ba dapat pag adult? So, pag adult clients po, we have the word at least. Okay? So, at least, 2 inches po dapat yan. It should be at least 2 inches, but not more than, more than 2.4 inches. So, again, this is for an adult client. 30:2, no? For a total of 5 cycles yan. And that 5 cycles, it should be for at least 2 minutes po. Now, with that at least 2 minutes, so the rule of 2, at least 2 inches, but not more than 2.4. Kasi pag sumobra po tayo sa 2.4, pwede kasi, ang dami kasi pwedeng possibilities na what if na mabali, 'di ba, yung ribs ng client po natin. And that will lead to what? No, tension pneumothorax. Kaya magulat ka na lang, bakit absent po ang breath sounds upon auscultating the lungs of the client? Kasi may pneumothorax na pala si patient. Bakit ang patient po biglang nag-complain ng sudden chest pain? So meaning may mga nade-develop na complications. And tension pneumothorax is a common complication po brought about by the rib, 'di ba? Ayan, biglang nabali, na rib fracture ang tawag po natin doon. So yes, it's at least 2 inches, but not more than 2.4. Wala pa naman pong update po na sa American Heart na pwedeng sumobra na ng 2.4. Basta ang sabi, not more than 2.4. Kasi if ever man kung may mga updates po, just keep posted lang po sa We Pump Training Center na Facebook page. Kasi mag-share po sila ng any updates po na regarding sa compressions po. Okay? Now, aside from the adult client, guys, ayan, what if may 1 rescuer tayo? What if may 2 rescuer? For the 2 rescuer, still you're going to perform the 30:2 pa rin, na a total of 5 cycles. What if 2 rescuers po tayo? The same po. 30 compressions plus your 2 ventilations, a total of 5 cycles. And again, this should be for at least 2 minutes po. Lahat mga informations po guys na today and tomorrow, magagamit niyo po yan sa NCLEX niyo din po. Kasi ang dami pong questions regarding BLS with COVID protocols. And the usual ang sagot doon, limit personnel, full PPEs po dapat if ever kung may suspected COVID patients po tayo. Because aside from Ayan, promoting safety, hindi lamang kasi dapat kay patient yan. Dapat safety niya din na as a medical frontliner. Kasi again, your CPR is again, ano nga yung term natin? It's an aerosol generating procedure. Kaya nga ngayon, sa mga bag natin, yung mga BVM po, may mga nilalagay po tayo known as the HEPA filter. Kasi that HEPA filter kasi tries to filter malamang na the virus. Especially it's the COVID virus po natin, the COVID-19. Okay, aside from the adult client, what if meron tayong child na patient po? Now, for the child patient kasi, what do you think is the best pulse to check here? Of course, we have the carotid pulses. Pag wala po siyang carotid pulses, you go with the femoral pulses, and that's for the child. Kanina po kay adult, guys, isulat po natin kay adult, malamang it's the carotid pulses ulit. Ayan. Pero pag child, the same, carotid pulses plus femoral sa may singit banda. Ayan. Pag child po natin kasi, depende kasi yan no? Kung 1 or 2 rescuer po ito. Now, for child, how deep ba pag child? Specific lang po siya, about 2 inches po. So, hindi po dapat siya susobra sa 2 inches. It should be about. Specific tayo. Now, if that's about, depende po yan. We have the 1 rescuer approach, and then we have the 2 rescuer approach po natin. Pag 1 rescuer approach kasi yan, guys, ayan, it should be, 30:2 pa rin. 30:2 for 5 cycles po yan. Pero kasi, pag 2 rescuer na po yan, we have the 15:2, a total of 10 cycles po, pag mag-15:2. The same pa rin, sir, that 1 rescuer approach, at least at 2 minutes pa rin yan. Okay po? So again, for the child na patient, 1 to 8 years old, it should be about, not 2 inches. Now, specific lang po tayo sa 2 inches. And then if you are a KA1 rescuer lang po, ayan, 30:2 for 5 cycles. Pero pag 2 rescuer na po yan, magiging 15:2 for 10 cycles na. Aside from the child, we have the infant. Sabay nga tayo. Everybody say infant.
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 Thank you so much. Thank you. Ayan. So, when we talk of infant kasi, guys, na pag 1 month old up to 12 months old, or let's say 1 year old ang bata. Ayan. Palitin ko ha, it's 1 month old to 12 months old. Baka nasulat ko 12 years old. Balikan ko nga, 12 months old naman nasulat ko. So 1 month old up to 12 months old, that's the infant, diba? Or 1 month up to 1 year old. Infant ang tawag natin sa kanila. Now, for the infant kasi, guys, now what do you think is the best pulse here? Anyone from the group? Best pulse po natin. The best pulse, walang ibang sagot. And that's the brachial. Thank you so much, ma'am. So we have the brachial pulses. Now, ituro nyo nga sa akin ang brachial pulses. Ayan. Ituro muna natin ang carotid. The carotid pulses, dito yan. It's the carotid. Ayan, pag nasa states na the carotid, di ba, arte-arte kasi ang states Wait lang ha. Pa-mute na lang po muna because we are hearing mga unnecessary noises. Hindi kasi namin mahanap kung sino yung Wait lang. Pa-mute na lang po muna. Okay, pa-mute na lang po. Kasi others kasi ay biglang naiirita na pag may mga naririnig na mga unnecessary noises. Okay, sa camera po. Look at me sa camera. Ayan, this is the carotid pulses. Sa states kasi carotid. So we have the carotid. Na pag sa Philippines naman, carotid. So we have the carotid pulses. So, di ba pag lalaki, Adam's apple and then brush the side. And that's the carotid pulses. And then, pag femoral pulses naman, syempre sa may inguinal area naman yon. And then, pag sinabi naman po natin, brachial pulses, nandito po. Okay, look at me sa camera. So we have the brachial pulses po natin. Lalo na pag infant po ang patient po natin. So those are the best pulses po natin. So again, pag infant, guys, it's the brachial pulses. Now, question, sir. What if 1 rescuer po tayo? And then what if na 2 rescuer approach po tayo? Pag 1 rescuer, same pa rin. It's 30:2 for 5 cycles. And then, pag 2 rescuer approach, magiging 15:2, a total of 10 cycles po yan. So we have the 5 cycles, and then we have the 10 cycles here. Okay po? So we have here the infant patients po natin. Okay? Ayan. Sige. So, recall next, we have your letter. Ayan. Letter A. Letter A. Letter H, rather. Now, for letter H naman po, there should be na has an obvious dapat. Has an obvious, okay, chest recoil. Kasi pag wala pong obvious chest recoil, meaning to say na may problema po kay patient, baka may rib fracture po ang patient po natin. So, dapat may obvious chest recoil. Now, sir, kasi pag negative na chest recoil, pag negative po ang chest recoil, that only means na baka positive na po ang rib fracture kay patient. So ano bang ibig sabihin ng chest recoil? I-draw ko ha. Ito yung chest mo. 'Di ba? As you compress the client, guys, bababa po ang chest ng patient po natin. And then as you release naman po, tataas na naman po siya. So ito yung normal. Kaya nga, you're going to bring back the chest to its normal level lang dapat. Ang tawag doon, chest recoil. Kung may chest fall tayo, dapat may chest rise din. So yun yung chest recoil. Kasi pag puro fall lang ng fall, meaning to say, nanggigigil ka kay client. At pag nanggigigil ka kay client kasi, possible po ang rib fracture doon. So dapat, obviously, now as you compress the client, ibabalik mo siya nasa normal, okay, na posisyon ng chest niya. Kasi pag, di ba, depress, compress lang ng compress na depress. So, meaning, kaya pala, na negative na ang let's say, breath sounds ng client kasi nagkaroon na pala siya ng rib fracture. Nagkaroon na po siya ng tension pneumothorax. Your pneumothorax kasi is the presence of environmental air nasa lungs po natin. Na normally kasi, ang lungs mo po has a negative pressure. So, pag nagkaroon ng positive pressure, guys, then, okay, that leads to pneumothorax. And again, x-ray lang din po ang nakaka-confirm kung may pneumothorax pa talaga ang client. Pero, tayo din, while let's say, auscultating for the breath sounds, bakit absent ang breath sounds? Yun pala, na one way din yon na para malaman natin kung may mga signs of complication na po tayo. And are you aware if ever kung may rib fracture po tayo, all you need to do is you need to go higher. The same pa rin, at the center of the chest, but you need to go higher. Do not go lower. Kasi pag pa-low ka ng pa-low, baka sa abdomen ka na magko-compress. Go higher. Go higher. Kaya 'di ba, never po tayo magko-compress na sa may xiphoid process. Although there is an era po na sa xiphoid process daw mag-compress. Alam niyo ba sa may nagulat naman tayo. Wait lang, pa-mute na lang. Pa-mute na lang, ma'am, ha. Ayan. So ayun po. Hindi ako na mag-mute. So ayun, guys, ako honest easily distracted po pag may mga sounds ayan, so yun guys, na if ever lang kung meron, 'di ba dati kasi na magko-compress daw sa may xiphoid process na area. Guys, sa may xiphoid process kasi na area, ang dami po natin mga floating ribs diyan. Kaya if ever man kung may mga floating ribs po tayo, may mga false ribs ka din, biglang nabali, so that leads to rib fracture. So from rib fracture to tension pneumothorax. Ayan, so aside from letter H, we have your letter A. Ayan. We need to avoid excessive ventilation. Sir, please underline the word excessive ventilation. Sir, is excessive ventilation dangerous and harmful? Exactly. Kasi pag sinabi po natin excessive ventilation, it causes two things po. So number one, when we talk of excessive ventilation, guys, it increases, ano yung i-increase, sir? Intrathoracic. So we have the intrathoracic pressure. Aside from the intrathoracic pressure, we have the intra-abdominal pressure will be increased. So we have intra-abdominal, and the intra-abdominal pressure po natin. Ayan. Sige po, sabay-sabay po tayo. Pa-unmute po ng mga po natin, ng mga microphones. Pa-unmute muna ha. Everybody say intrathoracic.
Intrathoracic.
Thank you so much. Ayan, thank you so much. Ayan, everybody say intra-abdominal.
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 Thank you so much. Kasi I'm trying to assess also your GCS status, di ba? Malay ko bang comatose na din kayo dyan. Kasi this is actually the challenge, di ba? If we're going to choose the online platform. Kasi ako honestly, mas gusto ko pa ang online platform ngayon kesa naman magka-issue tayo nagkakahawaan ng COVID. May mga trainings kasi akong naririnig na pinush talaga nila, like pumunta talaga sa hospital, tapos damay-damay na, si instructor pala yung positive, tapos nahawa pa yung mga trainees nila. So again, I hope the patients will always be there, kasi mas pipiliin po natin na mas safe na po tayo. Kasi okay lang sana kung tayo lang, di ba? Kasi nai-involve kasi yung family po natin. Lalo na pag may mga bata, so mas nakakaawa. Although, di ba dati kasi there was a study po na hindi daw masyado ganun kapangit na if ever kung ang mga pediatrics po or let's say yung mga babies, di ba, yung mga child po na ang nagkaka-COVID. However, kasi ngayon may mga studies na po na nagkaka-COVID na mga bata, tapos medyo papangit ng ex ko na taga Bicol din. Kaya my heart really goes sa mga people na nasa Bicol. Kahit naghiwalay man kami, para syempre, ayan, malapit pa rin ang syempre loob ko sa mga taga Bicol. Lalo na sa mga taga Legazpi. I stayed po sa Legazpi for almost a year. Kasi I stayed with V-Pump for almost mga 11 years na po or mga 10 years na din. So matagal na po kaming nagsasama ng V-Pump whether sa actual na training or whether sa sa virtual or sa online. Let's go back po sa ating problems. Alam niyo ba guys, pag may excessive ventilation po tayo, lalo na pag nag-bag tayo, yung iba kasi sa atin, pag nakahawak ng BVM, do not address that as your ambu bag. Kasi mali po na tawagin mo siyang ambu bag. Ambu bag is actually a brand name and we don't promote brands here. So it's BVM. Your bag, your valve, and your mask. Okay, it's BVM. Now, with BVM kasi or the bag valve mask, yung iba sa atin pag nakahawak, pump lang ng pump. Delikado ba yon? Of course. Now, we need to follow a certain kasi na counting dapat for ventilating the client. Ayan. Why? Because it causes number one, an increased intrathoracic pressure. If there will be an increased intrathoracic pressure, guys, so what happens now? There will be a decreased cardiac output. There will be a decreased cardiac output. Now, pag decrease po ang cardiac output, automatic po decrease din po ang venous return. Decrease ang venous return. So meaning, tsatsaka po ang prognosis ni client. So again, from increase intrathoracic, iipitin kasi ng thoracic cavity mo ang heart po natin. So therefore, magdi-decrease ang cardiac output, leading to a decreased venous return. So pangit po ang compression fraction ratio po natin or the CFR. Though later, may-discuss naman yung compression fraction ratio. Next, what if naman po, sir, pag let's say nag-increase ang intra-abdominal pressure po natin. If there will be an increase in intra-abdominal pressure, ayan, what happens ba? Now, guys, number one, there will be an increased backflow. There will be an increased backflow of GI contents. Delikado ba pag may backflow of GI contents? Exactly. Kasi what happens ba? That leads to aspiration pneumonia. So there will be an aspiration, pneumonia. As we all know, kasi your aspiration pneumonia is a form of chemical pneumonia. When I attended a seminar sa UST, ang sabi kasi nila doon, only 75% po, 75% mamamatay si client. Only 25% po pwedeng ma-rescue si client. Kaya delikado po si aspiration pneumonia. By the way, your aspiration pneumonia is a form of chemical pneumonia. Na? Ayan, so leading to pneumonitis. So delikado nga. So ulitin ko lang. We need to avoid excessive ventilation. Now, for what reasons po? Number one, excessive ventilation causes an increase in intrathoracic pressure. So pag may increase intrathoracic pressure po tayo, magdi-decrease ang cardiac output po natin. Pag magdi-decrease ang cardiac output, then magdi-decrease din po ang venous return. Pangit ang prognosis ni client. Next, in promoting po excessive ventilation, another problem will be an increase in intra-abdominal pressure. Ayan, sulat ko lang ang increase ha. Pag nag-increase pa ang intra-abdominal pressure po natin, there will be an increased backflow of GI contents. So lalabas yung mga GI contents po natin. And what if papasok po yan sa lungs po natin? So that causes aspiration pneumonia. Your aspiration pneumonia is a form of chemical pneumonia. Okay, it's a big no-no. 75% mamamatay si client. Only 25% pwede ma-revive ang patient po natin. Now, meaning to say, sir, what's the management here? I'll give a scenario. Okay, I'll give a scenario po natin. Ayan. Sir, what's the first scenario? Let's say the patient na has pulse. May pulso ang patient mo. Pero ang patient mo, guys, ay hindi po humihinga. Ulitin ko ha. The patient has pulse rate, but the patient is not breathing. So ano ang management po natin dito? The usual management known as your, anong tawag natin doon, guys? It's the rescue breaths. Rescue and rescue breaths. Paano ba mag-perform ng rescue breaths? Depende sa patient yan. We have an adult client. We have a patient who was hooked to an advanced airway. Ayan, we have a patient who was hooked to an advanced airway po. Pag sinabi po natin advanced airway, ito yung mga intubatations. Next, we have the child and infant. The same lang kasi si child and infant po natin. Pag adult, guys, now you need to give one bag. So it's one rescue breath na every 5 to 6 seconds. Pag adult. Pag with advanced airway naman po, it's one rescue breath every 6 to 8 seconds. Pag child and infant naman po, it's one rescue breath, meaning bag, every 3 to 5 seconds. For a while lang po ha. Ayan. Ayan, one rescue breath every 3 to 5 seconds po. So ulitin ko, I want you to put an asterisk with the adult client. Pag sinabi po nating one rescue breath, meaning isang bag, isang press lang po ng ating bag, yung BVM po natin. That means one rest camera. Ganito mag-count. So you bag 2 times muna. Why? To check kung may chest rise ba talaga. Kasi upon checking po, si patient po ay may pulso pero hindi po siya humihinga. So you bag 2 times. 1 and then 2. Then check for breathing. Na check for chest rise. If obvious po na may chest rise, then you start counting. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000 bag. Isang bag lang. And then, you need to repeat that for 5 cycles, meaning for 5 bags. And then every after 5 bags, you're going to check ulit kung bumalik ba ang breathing ng patient natin. Pag if with an advanced airway naman po, hawakan mo yung tube ni patient, endotracheal tube, na i-secure mo, and then you bag, di ba? So bag ulit tayo 2 times, 1 and then 2, to check for chest rise. Obviously, may chest rise tayo, then you resume counting. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000 back. For how many times ulit? For 5 bags po tayo. For 5 cycles ang tawag doon. Child and infant, the same pa rin. However, look at me sa camera. Guys, utang na loob. If we're going to bag for a child, half squeeze lang tayo, ha? Half lang. Pag adult, full squeeze. Pag child, half squeeze. Pag infant po, Diyos ko, no? 2 fingers lang dapat pag infant. Ganon lang si infant, oh. 2 fingers lang. However, ang nangyayari ngayon, nakikita po natin sa hospital just kapag nakabag ng infant, full squeeze. Alam nyo ba, very common po yung increase in intra-abdominal pressure sa ating extremes, too young and too old client. Kaya protektahan po ang mga bata. Huwag mag-full squeeze no, pag alam mong infant yan. Use your 2 fingers lang po no, pag infant. Mamaya, may mga videos po tayo. Okay, so we're done na po. Nasa ating principles of high-quality chest compression by following the mnemonic po siya. Sige nga, guys, ano nga yung letter P natin? Recall tayo. Letter P stands for what?
Push hard, push fast.
Pa-unmute na lang. Push hard and push fast. Great. Your letter U, guys. It's
Necessary interruption.
unnecessary.
Interruption.
Must be minimized. Thank you.
Interruptions.
Thank you so much. Your letter C. Compression.
Deafness.
And compression deafness must be adequate. Thank you so much. Your letter H po has an obvious has an obvious chest recoil. Ayan, next, we need to avoid excessive ventilation po. Now, at this point in time, we'll be having our break po, no, for 30 minutes, guys. Kasi I need to fix also the internet connection here and then try to recall din, try to study na po sa mga na-start na po natin na lecture kasi you will be having a post-test later. A failure po sa post-test, let's say, di ba, mistakes of 5 mistakes po, hindi nyo na po marireceive po yung cards and certificates po natin. Kaya kailangan as much as possible ipo-perfect po natin ang ating exam. Okay? So I'll be giving you 30 minutes. 30 minutes break tayo ha. So we will resume at exactly 9:30.
Sino yung mami? Bakit?
Para sa clinic. Hello, good morning. Colleagues, please chat your names, your full name that will appear on the certificates and IDs po. I'll chat the exam. Again, hello sa ating 32 participants. Please type your name po that will appear on your certificates and IDs, email, and the training. Thank you, Miss Emily. Please send it now po para hindi po ma-delay ang certificates and IDs niyo po. Noted, Miss Cathy.
Mute, unmute. Di man mute, ito mute.
While waiting po, I'll be playing some of the COVID na mga COVID na mga videos po natin.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition. While this all sounds scary, the push to develop a coronavirus vaccine is moving at high speed. Studies of other coronaviruses led most researchers to assume that people who have recovered from a SARS-CoV-2 infection could be protected from reinfection for a period of time. But that assumption needs to be backed by empirical evidence, and some studies suggest otherwise. There are several different approaches for a potential vaccine against the coronavirus. The basic idea is that you would get a shot that contains faint versions of the virus. The vaccine would expose your body to a version of the virus that is too weak to cause infection, but just strong enough to stimulate an immune response. Within a few weeks, cells in your immune system would make markers called antibodies, which would be specific for only the coronavirus, or specifically its spike protein. Antibodies then attach to the virus and prevent it from attaching to your cells. Your immune system then responds to signals from the antibodies by consuming and destroying the clumps of viruses. If you then catch the real virus at a later stage, your body would recognize it and destroy it. In other words, your immune system is now primed. Collecting evidence on whether this will be possible, safe, and effective is part of what's taking researchers so long to develop a vaccine. It's a race against time to develop a vaccine amid a pandemic. Each step in vaccine development usually takes months, if not years. An Ebola vaccine broke records by being ready in 5 years. The hope here is to develop one for the new coronavirus in a record-breaking 12 to 18 months. While all of this will take time, stay home if you can, to protect the most vulnerable. And don't forget to wash your hands for at least 20 seconds and as often as possible. This video was a collaboration between Nucleus Medical Media and the What If channel, where we usually dive into hypothetical scenarios about the human body, humanity, our planet, and the cosmos. Check out our channel by visiting the link in the description below.
It's some time. Symptoms of coronavirus, COVID-19. Novel coronavirus, or 2019 nCoV, is a new strain of coronavirus which was first detected in Wuhan, China in December 2019. The disease caused by novel coronavirus is named as COVID-19. Fever, tiredness, and dry cough are the most common symptoms of COVID-19. Some infected people may also experience aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Symptoms of COVID-19 are usually mild and begin gradually. Also, surprisingly, some infected people don't even develop symptoms and don't feel unwell. It is estimated that more than 80% of people recover without the need of special treatment. But it is also estimated that 1 out of 6 people suffering from COVID-19 will become seriously ill and will develop difficulty breathing. Also, people with underlying medical problems like high blood pressure, heart problems, or diabetes, as well as older people, are more likely to develop serious illness. It is advised by WHO that people with fever, cough, and difficulty breathing should seek medical attention. Protective measures against coronavirus, COVID-19. Washing hands frequently. Washing your hands with an alcohol-based sanitizer kills viruses and thus stops the spread of COVID-19. Maintaining social distancing. When someone infected with COVID-19 coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. Social distancing is deliberately increasing the physical space between people to avoid spreading illness. Avoid touching your eyes, nose, and mouth. As our hands touch many surfaces, we may accidentally pick viruses from there. Now, if we touch our eyes, nose, or mouth, we may transfer the virus. The virus can enter our body from there and get us infected. Practice respiratory hygiene. An infected person can help protect people around him if he practices respiratory hygiene, like covering his mouth and nose with his bent elbow while coughing or sneezing. Coronavirus myths. Myth number 1. Eating garlic can help avoid infection. Consuming garlic has its advantages, but as per WHO, it does not protect us from COVID-19. Myth number 2. Drink water every 15 minutes. There's no evidence to suggest that this virus can be flushed out of the system by drinking a lot of water. Myth number 3. Don't eat ice cream. It is being believed that not eating cold food and thus keeping the body heated will make it difficult for the virus to survive. This is not true. Myth number 4. Drinkable silver. Some are suggesting drinking tiny particles of silver suspended in liquid. It is risky to do so, and it is not shown to cure COVID-19 nor boost our immunity. Myth number 5. Holding breath. If a person can hold breath for more than 10 seconds, then one can avoid infection. Experts say this is simply not true. Myth number 6. Use of vodka as a hand sanitizer. This is not true because it does not contain enough alcohol to kill the virus. What is a coronavirus?
It is an alien which is hunting all of us.
Oh, some. Coronaviruses are a large family of viruses. They're found in animals as well as humans. Some of them are known to infect people and cause illnesses such as Middle East Respiratory Syndrome, as in MERS, and severe acute respiratory syndrome, as in SARS. Novel coronavirus, or 2019-nCoV, is a new strain of coronavirus which was first detected in Wuhan, China in December 2019. The disease caused by novel coronavirus is named as COVID-19. Here, CO and VI are taken from the word coronavirus, while D stands for disease and 19 stands for year 2019. Some people might suffer from mild symptoms like runny nose, sore throat, cough, and fever because of the virus, while some might experience severe symptoms leading to pneumonia. For some people, this disease has also proven to be fatal. Research is still on, but the animal source of the novel coronavirus has not yet been identified.
In this scenario, the healthcare worker undertaking aerosol generating procedure is using a coverall, an FFP3 mask, eye protection, and non-sterile gloves as personal protective equipment. Perform hand hygiene before donning on personal protective equipment. Ensure that you are bare below the elbows and wash your hands with soap and water or use an alcohol-based hand rub. Put on a coverall that is the appropriate size for you. Do not apply the hood of the coverall as there is no requirement for airborne transmission. Also, we recommend putting it on back to front as it is safer to remove afterwards. Your buddy can zip up the back of the coverall. Next, put on the FFP3 mask. Ensure this is the model of mask you have been fit tested with. Perform a fit check. Next, put on eye protection. If using the visor, ensure it fully covers your face. Lastly, put on gloves. Ensure the gloves cover the cuff of the coverall. The healthcare worker is now fully donned. When you have finished the care activity, personal protective equipment must be promptly removed. It is imperative that you protect the mucous membrane, nose and mouth. While inside the room, remove the gloves first, as these are the most contaminated part of your personal protective equipment. Do not touch the outside of the gloves as this is contaminated. Dispose of them in the bin and then perform hand hygiene. Next, step outside into the amber zone.
Let's resume now. And so I'll be showing you the coronavirus update po with John Hopkins updates. So as of today, US pa rin po ang nangunguna. And then sa Philippines naman po, so yeah, kasama pa rin tayo sa top 10. So as of today, 535 na po yung cases. 535,553 yung cases po. And then yung deaths po in the Philippine setting, nasa yeah. As of today lang yon. Pero yeah, as of today also, 4,677 deaths. Ito yung nakalagay sa John Hopkins po. Pero a total of, no, all-in na po sa Philippines, guys, umabot na po ng 2,453,328 yung cases po natin. Total deaths na, since nag-start talaga si COVID, was 37,405. So madami nga. Let's continue. So we ended po kanina sa ating mga principles of high quality chest compression. Let's go back sa slides po natin. So I'll be presenting to you na po yung mga latest chain of survival po natin. For a while lang ha. I-on ko lang yung video ko. So with your latest chain of survival, we usually start na sa ating recognition and activation of the emergency response system. And then to be followed by the early high-quality chest compression, to be followed by early defibrillation. And then we have the EMS, kasi ita-travel na po si client po natin from a pre-hospital setting to an intra-hospital setting, which is the advanced life, or the advanced cardiac life support. By the way, I'd like to plug this one also, na at exactly 1 p.m., we will be having a seminar po, na more of, actually a free seminar. So everyone is entitled na to join. And then, so masastop po temporarily ang ating discussions and then we will resume tomorrow kasi kailangan nyo din po ng seminar na yon. And then good news also, we will be having prizes like free BTLS or hindi BTS ha, ang sabi ko BTLS, the Basic Trauma Life Support. So, ang speaker po natin mamayang hapon is si Dr. Ted, our celebrity doctor, from ABS and GMA. Ayan, so ayun po, for the registration, may sinend po si Ma'am Joy. Ito ba yung registration natin, ma'am?
Well, meron ako, sir, sinend na link. Ito po,
Yes
send
po.
ko lang.
Ayun.
Pasok po kayo dito sa different link natin. Yan.
Yes, so the topic po is entitled New Normal
kung,
Preparedness.
Kung hindi po sila, madam, maka-join sa Zoom link, pwede po sila via Facebook page.
Yes po. And then later, guys, na may request lang kami, since this is a free seminar, tapos bigatin pa ang ating speaker, si Dr. Ted Isguera, tapos meron po kami ipaparaffle po na randomly we will select 20 names to avail the free BTLS po na seminar po natin. And alam niyo ba, worth nasa 20,000 po yung BTLS po na seminar. O di ba? I mean, the training po. Tapos ibibigay lang namin for free. So ang swerte lang talaga ng mga na mapipili po namin mamaya. Okay po? So we'll see you po at exactly 1 o'clock later. Ayan, kasi may mga po tayo, may mga paraffle draw po tayo doon. So nakalagay na po sa ating chat box, the seminar is entitled New Normal Preparedness Configuration for Medical Frontliners. Speaker will be Dr. Ted Isguera. Ayan, so nakalagay na po yung Zoom meeting po natin. Okay, double check na lang po. So we're done with the latest chain of survival. Yes, ma'am.
Paki-save nyo po yung link kasi pag nag-leave po kayo dito sa Zoom natin, i-end po namin tong Zoom natin for the BLS and ACLS. And we will open this link, yung Zoom link natin for the free seminar. Kaya save nyo na po ito para makapasok po kayo sa seminar po natin. Yan.
Yes,
Tapos po, pwede nyo pong i-invite yung mga colleagues nyo po dyan, dito sa link na to. Punta po kayo sa page namin. Pwede nyo pong i-share sa mga group chats nyo po. Kasi free lang po ito and may certificate din po ito. Sayang din po, baka din po sila manalo ng ating 20 participants free BTLS or Basic Trauma Life Support on October October po natin yon. Share nyo po guys ha. Meron din po kaming pa-free sa mag-share. Thank you. See you
Yes.
later po.
Thank you, Ma'am Joy. So, again, sabi po ni Ma'am Joy, kailangan pong mag-share or na, and then invite your friend. Nurse talaga siya. Na in the new normal setup talaga. So may mga COVID protocols po na i-discuss na si Dr. Ted. Okay? Ayan. So again, tapos na po tayo na to when to start. No? So we'll discuss naman, okay, when to, what? When to stop. Sulat po natin. So when to, ayan, stop. Now guys, usually now we stop the what we call as the high quality chest compression with the mnemonic stops then. Sige nga, sabay-sabay po tayo. Everybody say stops.
Stop.
Thank you so much. Yes.
Stop.
Now, pag sinabi po natin stop, guys, letter S stands for if there will be a spontaneous return of circulation. When we say spontaneous return of circulation, always check if bumalik na po ba yung pulse rate ng patient po natin. Aside from the pulse rate, no, if ever kung present na po ang pulse rate, we need to check the BP. And then aside from checking for the BP, we need to check for the PET CO2 or the partial Untitled CO2 ng patient po natin. These are the signs of life. So meaning to say, itong tatlong to, ang tawag po natin dito is they're the ROSC. Guys, pag sinabi ko pong ROSC, that means the return of spontaneous circulation. Meaning, pag may pulse rate na, pag may BP na, at pag may PET CO2 or partial Untitled CO2. Next, we need to stop also if dumating na po yung 911 kasi magta-turn over na po tayo. Turn over to 911. Okay po ba? Kasi 'di ba somewhere po nung nag-start tayo ng BLS, we need to activate the emergency response system by simply calling the 911 or activating po yung emergency response natin. Next, if ever kung pagod ka na, you better stop if there will be overexhaustion. Matanong ko lang, sino ba dito ang may mga ex, 'di ba? Halos lahat naman po tayo. Pag nakita nyo guys, no? Si ex pala, no? Ang let's say naging unconscious. Iko-compress mo ba? Hindi. Baka kasi pag tumawag ako ng pangalan, no, tapos kasama niya pala yung husband niyo. Baka
Hello Sir Mark, nawala ka po. Hintayin lang po natin ulit sa Sir Mark, baka na-disconnect po siya. Actually, may problem ngayon dito sa Bicol ang Converge and DCTV. Yan. Pahintay na lang po. Again, while waiting po, invite ko ulit po kayo later po, 1 p.m. sa ating free seminar dahil 9 years na po tayo with the topic New Normal Preparedness Configuration for Medical Frontliners. Our speaker will be Dr. Ted Esguerra. Yan, pwede niyo pong i-invite ang mga friends niyo, colleagues, kahit po hindi frontliners, kung gusto pong matuto, pwede pong mag-attend. Yan, welcome back, Sir Mark.
Hello. Sorry po.
Yes, wala.
Feeling ko may bagyo talaga, ma'am. Kasi
Anong internet mo? Anong internet mo, sir?
naka-globe ako eh. Naka-globe ako.
Oo.
Pero ngayon,
Ngayon
ma'am,
nga,
maulan
surado
kasi
kami.
ngayon, ma'am. Sa Davao, ma'am.
Oo,
Sobrang
pag maulan talaga.
Oo.
Okay.
Pasensya na po. Live po
Po.
tayo ngayon, guys. So again, i-plug lang po namin yung seminar po mamayang hapon. And malaki-laki po yung mga pa-premyo po doon. Worth nasa mga 20,000 kasi pag 50,000 pala eh, di ba, ma'am? Oo, 50,000 pala ang BTLS. Pero sobrang
20 participants po yung pipiliin natin.
bongga ha. Kaya pasabi na lang po sa mga friends po natin.
On October
And
na po yun. October po yung training po natin ng BTLS. It's on October 20... October 2 and 3, sorry. October 2 and 3, yung BTLS natin.
Si Sir Charlton, dapat mag-join mamaya kasi EMTB. Tapos magagamit po natin yung mga certificates po natin, 'di ba? Sa lalo na sa mga ER nurses and ER doctors po natin, kailangan po ng mga BTLS.
Yes po.
Ayan. So we have the overexhaustion. Thank you, ma'am. So if ever po guys, like let's say pagod na pagod ka, you can actually stop your high quality chest compression. Nasabi ko nga kanina, what if, 'di ba? You survey the scene is safe, and then magulat ka na lang si ex mo pala to. So the question is, ipapagpatuloy mo ba ang pag-compress sa kanya or hindi? So depende. Pero I'm sure na pag mga taga Bicol talaga ay mababait, na since this is our calling. So malamang magko-compress talaga kayo. Pero yung iba bitter talaga, hindi talaga nila i-compress ang kanilang mga exes. Ako din, syempre hindi na din. Now, letter P, if the physician, assumes responsibility. Now, pag sinabi po natin, if the physician assumes responsibility, then meaning to say, si physician lang po ang allowed na mag-declare po na patay ang client po natin. So if there will be signs of death, yung mga algor, mga rigor mortis po natin, 'di ba? Pag may mga decomposition po tayo, so the physician will will directly say na okay, time of death na 7:15. So ito yung mga doctors po na present po sa ating training ngayon. Magandang umaga. Next, we have letter S, if the scene is unsafe. Why? If the scene po kasi is unsafe, then baka ikaw na naman po ang mapapahamak. So magiging dalawa na ang patient, na dapat isa lang dapat. Okay? So ulitin ko lang ha. When do we usually stop high quality chest compression? By simply following the mnemonic stops. Letter S, if there will be spontaneous return of circulation. Next, we have the turnover to 911. We have overexhaustion pag pagod ka. Next, we have the physician, if the physician assumes responsibility. Meaning to say, pag si nursing aide nag-declare, sabi niya time of death, malamang hindi tayo maniniwala. Even yung mga kasamahan po natin na nurses, si doctor lang kasi ang may karapatan po na magsabi. Pero tayo, since alam natin ang mga signs of death, pwede nating ipa-confirm talaga. Pero na lang kung DNR talaga ang patient, or do not resuscitate, guys. So next po will be if the scene is unsafe. Meron kasi tayong mga force majeure. Let's say may mga incoming na mga tsunami, 'di ba? Let's say in the event of earthquake po, so wag na po tayong magpaka-hero. Instead na magpaka-hero tayo, nagpaka-pasyente na lang po tayo, So kawawa naman po tayo, guys. So again, that's your the mnemonic stop. Now, next topic po will be the defibrillation and of course the airway management. Now, for the airway management kasi I will be showing a video included na po ang tinatawag na intubation po natin. So ang gagawin niyo po ngayon, full volume po kayo because I'm about to share na the video known as the Airway Management. For a while. Ayan. Full volume na tayo ha. This will take mga 23 minutes po. Full volume and then magsulat po kayo. This is based on the American Heart Association 2020 guidelines.
Managing a patient's airway is a fundamental life-saving skill, one that both basic and advanced healthcare providers should be able to perform well. Airway management is one of the key interventions for BLS and ACLS. It is critical before, during, and after cardiac arrest. The optimal method of managing the airway will vary based on provider experience, training, scope of practice, EMS or healthcare system protocols, and the patient's condition. We'll review effective bag mask ventilation using both single and two-person techniques. We'll review the steps of responding to a respiratory arrest and the recommended use of waveform capnography to monitor and confirm the placement of advanced airways. Before we get into the specific airway skills, let's review the recommended ventilation rate for cardiac arrest patients. For patients in cardiac arrest, provide 2 ventilations with the bag mask device after every 30 chest compressions. After inserting an advanced airway, healthcare providers should continue ventilations by providing asynchronous ventilations once every 6 seconds. If a patient is in respiratory arrest and has a pulse but is not breathing, ventilate once every 5 to 6 seconds. After 2 minutes, reassess the pulse. When giving ventilations, healthcare providers should avoid excessive ventilation or administering tidal volumes that are too large. Not only can this cause gastric insufflation and aspiration of gastric contents, but excessive ventilation also increases intrathoracic pressure and decreases venous return to the heart, so it lowers cardiac output and the patient's chance of survival. Tidal volume should be approximately 500 to 600 milliliters, enough to see the chest rise. This is about half a squeeze of an adult ventilation bag. Let's begin with basic airway skills. The first 2 steps in any airway management response involve opening and clearing the airway. First, open the airway by using a head tilt chin lift maneuver. Place one hand on the forehead and one on the chin, and push with your palm on the forehead to tilt the head back while lifting the jaw to bring the chin forward. This simple maneuver lifts the tongue from the back of the throat, opening the airway. This procedure is typically performed on patients without any evidence of head or neck trauma. In patients with suspected cervical trauma, a jaw thrust without head extension is used. In a jaw thrust maneuver, place your fingers just under the angles of the lower jaw and lift with both hands, displacing the jaw forward. If the jaw thrust does not open the airway, use the head tilt chin lift, because maintaining a patent airway is a priority. The second step is to clear the airway. Providers should suction the airway immediately if there are copious secretions, blood, vomit, or a foreign body. Use large bore, non-kinking suction tubing and a large suction catheter with a rigid pharyngeal tip. High suction pressure may be required. Once the airway is open and clear, you may consider use of an airway adjunct to maintain a patent airway. There are 2 types of airway adjuncts, the Oropharyngeal Airway, or OPA, and the Nasopharyngeal Airway, or NPA. OPAs are commonly used for patients who are unconscious and have no gag reflex. NPAs may be used for conscious, semi-conscious, or unconscious patients with or without a gag reflex. The OPA is a J-shaped, single-use, disposable plastic device. OPAs are available in various sizes, with the most common adult size ranging from 8 to 10. Here's how to choose the correct size OPA. Place the OPA against the patient's cheek. When the flange of the OPA is at the corner of the mouth, the tip is at the angle of the mandible. A properly sized and inserted OPA results in proper alignment with the glottic opening. To use the adjunct, insert the OPA so that it curves upward, with the tip pointing to the hard palate. As the OPA passes through the oral cavity and approaches the posterior wall of the pharynx, rotate it 180 degrees into the proper position. Alternatively, the airway can be inserted sideways and rotated 90 degrees into place. Once properly inserted, the OPA holds the tongue away from the posterior wall of the pharynx. It also provides access to the throat for suctioning and prevents the patient from biting an advanced airway. OPAs that are too large may obstruct the larynx or cause trauma to the laryngeal structures. OPAs that are too small or inserted improperly may push the base of the tongue posteriorly and obstruct the airway. Healthcare providers should insert the OPA carefully to avoid soft tissue trauma to the lips and tongue. Remember to use OPAs only in unresponsive patients with no cough or gag reflex. If the patient has a cough or gag reflex, the OPA may stimulate vomiting and laryngospasm. Only healthcare providers trained in the proper use of an OPA should attempt its insertion. The NPA is a soft, curved, hollow tube that can be inserted through the nostril to facilitate ventilation and suctioning. Unlike oral airways, NPAs may be used in patients who are conscious, semi-conscious, or unconscious, with or without a gag reflex. In choosing the correct size, make sure that the length of the NPA is the same as the distance from the tip of the patient's nose to the earlobe. Before inserting an NPA, lubricate the airway with a water-soluble lubricant or anesthetic jelly. Insert the NPA through the nostril in a posterior direction perpendicular to the plane of the face. Using moderate pressure and a gentle spiral motion, push the device into the nostril. When inserted correctly, the NPA should reach beyond the nasal cavity to the pharynx, providing a clear path for ventilation and suctioning. If you encounter resistance during insertion, gently withdraw the NPA a centimeter or so, slightly rotate it, and gently try to insert it again. If you continue to encounter resistance, withdraw the airway completely. You may try inserting it in the other nostril. Use caution when inserting the NPA in patients with severe head or facial trauma because of the risk of misplacement into the cranial cavity. With a known basal skull fracture, an oral airway is preferred. Take care to insert the NPA gently to avoid complications such as tissue injury or bleeding. An NPA may also cause laryngospasm and vomiting. An improperly sized NPA may enter the esophagus and cause gastric inflation with active ventilation. After inserting either an OPA or NPA, it's important to check whether the patient is getting adequate ventilation by listening for breath sounds. During resuscitation, patient ventilation is commonly provided with a bag mask device. First, let's look at the device itself. A bag mask device is composed of a self-inflating or flow-inflating bag that is attached to a clear, cone-shaped face mask that covers the patient's nose and mouth. The edge of the mask has an inflatable cushion, enabling a tight seal around the nose and mouth when the provider applies pressure to the mask and lifts the jaw. Now, let's see how to properly use a bag mask device. First, position yourself directly at the top of the patient's head. Place the mask over the patient's face. Before providing bag mask ventilation, the provider must first perform a head tilt and then press the mask against the face while lifting the jaw into the mask. This is best achieved by forming a C with the index finger and thumb of one hand on the top side of the mask at the bridge of the nose. This motion firmly secures the mask to the face. At the same time, the three remaining fingers form an E and should be used to lift the jaw, opening the airway. While maintaining a tight seal between the patient's face and the mask and maintaining a jaw lift to open the airway, the provider should squeeze the bag, taking about 1 second to deliver one breath. For a patient who has spontaneous circulation but needs ventilatory support, the provider should give rescue breaths at a rate of 1 breath every 5 to 6 seconds. An effective breath results in visible chest rise. The most effective way to deliver bag mask ventilation is to use the two-person technique. The first provider focuses on keeping the airway open and securing the mask, while the second provider delivers ventilation with the bag. The first provider uses both hands to seal the mask to the patient's face and lift the jaw. The thumbs and index fingers of both hands each form a C, ensuring a good mask seal against the face, with the 3 remaining fingers of each hand forming the E, lifting both sides of the jaw into the mask. The second provider squeezes the bag, enough to cause visible chest rise. When using a bag mask device, whether there are 2 providers delivering breaths or just one, be careful not to press too hard on the mask, which could push the patient's jaw down and obstruct the airway. There are several possible indications for insertion of an advanced airway. These include difficulty providing effective bag mask ventilation, patients with actual or potential airway compromise, particularly with long transport times, or the need to isolate the airway. With careful attention, trained healthcare providers can use an advanced airway to safely provide ventilation that is as effective as bag mask ventilation. Advanced airway devices offer many advantages. These include isolating the airway and reducing the risk of aspiration and gastric insufflation. After inserting an advanced airway during CPR, providers should deliver 1 breath every 6 seconds without interrupting chest compressions. Unfortunately, insertion of some advanced airway devices, like an endotracheal tube, may require interruptions in chest compressions that last longer than 10 seconds. These interruptions may reduce survival rates for VF arrest patients. It should also be noted that there is no evidence that advanced airway measures improve cardiac arrest survival rates in either in-hospital or out-of-hospital settings, so providers must carefully consider all these factors before performing the intervention. There are other advanced airway devices that healthcare providers can often insert without interrupting chest compressions. These include supraglottic devices, such as the laryngeal mask airway, the laryngeal tube, and the esophageal tracheal tube. Healthcare providers who use advanced airways within their scope of practice must maintain their skills by using them frequently. The American Heart Association recommends that you become familiar with a variety of devices, but master one primary method of advanced airway control. If you're unable to establish an advanced airway, continue ventilation with a bag mask device. The laryngeal mask airway is a supraglottic airway device that healthcare providers can insert without visualizing the glottis. In addition, it can be inserted during CPR while chest compressions continue uninterrupted. This makes training easier and insertion more reliable. The laryngeal mask airway is a tube with a distal inflatable cuff shaped like a mask that is placed in the patient's hypopharynx. Place the laryngeal mask airway in the open mouth with the opening of the mask facing the patient's tongue. Advance the device to the back of the tongue. In a smooth motion, use your index finger to press the laryngeal mask airway against the roof of the mouth and guide it downward. Continue advancing the device until you feel resistance, which indicates the distal end of the tube has reached the hypopharynx. Withdraw your finger and inflate the mask. Once inflated, the laryngeal mask airway will center itself in the mouth. If placed correctly, oxygen will flow through the lumen of the device and into the trachea. The laryngeal tube is a supraglottic device that can be inserted in an unconscious patient. Providers can insert the device during CPR while chest compressions continue. The device can also be inserted without visualizing the glottis. The laryngeal
Hay, nawala ulit ako. For a while lang po ah.
tube is a single
Live po tayo, pasensya na.
lumen device with two cuffs inflated through a single inflation port. The distal tip of the tube is angled and beveled to easily slide into a collapsed upper esophagus. The design also reduces the likelihood of tracheal insertion. When the tube enters the esophagus, you should feel resistance. Inflate the cuffs with a single syringe. The esophageal tracheal tube is a supraglottic device that providers can insert during CPR without interrupting chest compressions and without visualizing the glottis. The esophageal tracheal tube is made up of two lumens permanently joined. Each tube can be used to provide oxygenation and ventilation, depending on how it's inserted. The longer blue tube, marked with a number 1, provides ventilation through 8 small side openings of the lumen in the pharyngeal section. The shorter, clear tube, marked with a number 2, provides ventilation directly through the lumen to the end of the tube. Once the tube is in place, use the large blue syringe to inflate the pharyngeal cuff through the port labeled number 1. Then use the smaller syringe to inflate the distal cuff through port number 2. The distal tip of the device will rest in either the esophagus or the trachea. If the tube rests in the esophagus, which happens most frequently, the cuff blocks airflow in and out of the esophagus, and ventilation occurs via lumen number 1 and through the small side openings into the trachea. If the tip of the tube comes to rest in the trachea, however, the rescuer can use lumen number 2 to deliver ventilation directly into the trachea. Caution: it's critical to confirm the proper placement of the esophageal tracheal tube, because if ventilation is delivered to the incorrect lumen, it will prevent adequate oxygenation and ventilation and result in severe hypoxia. Incorrect delivery of ventilation to the esophagus will also produce gastric insufflation that will complicate ventilation. The endotracheal tube was once considered the optimal method of managing the airway during cardiac arrest. However, intubation attempts by unskilled providers or by providers who use it infrequently can produce serious complications, such as trauma to the oropharynx, incorrect placement in the esophagus or right main bronchus, and prolonged interruptions in compressions and ventilations. Despite the risks of intubation in inexperienced hands, there are many benefits to endotracheal intubation. These include keeping the airway patent, allowing suction of the airway, speeding the delivery of high concentrations of oxygen, providing an alternative route for some drugs when intravenous or intraosseous routes are not available, and when using a cuff, potentially protecting the airway from aspiration. The endotracheal tube is a single clear lumen with a single cuff. To insert the endotracheal tube, place the patient's head in the sniffing or neutral position. Insert the laryngoscope blade into the patient's mouth. Lift the laryngoscope vertically up and away to expose the vocal cords and glottic opening. Insert the endotracheal tube directly between the vocal cords and into the trachea until the cuff passes the cords. Once the endotracheal tube is in place, inflate the cuff and attach a waveform capnography monitor to confirm proper tube placement. When choosing to use an advanced airway, you need to be confident that it is inserted correctly and that you're providing effective ventilation while avoiding excessive ventilation. Watching for chest rise, checking for bilateral breath sounds, and listening for gurgling sounds coming from the stomach can help you confirm the placement of an advanced airway. Beyond these clinical assessments, there are several devices that can help you determine whether you have inserted the airway correctly. Waveform capnography monitors how much carbon dioxide is exhaled by the patient. The American Heart Association recommends using waveform capnography to confirm and monitor the correct placement of an endotracheal tube. Scientific studies have not yet validated waveform capnography as a method of confirming proper placement of supraglottic airways. However, effective ventilation through these airway devices should produce a capnography waveform. A normal end-tidal CO2 waveform looks like this. The measurement of the amount of end-tidal
Hello, madam. Nawala po. Ayan, nawala ulit si Sir Mark. Pasensya na po. Unstable po talaga ata yung connection niya. Anyway, while waiting po, meron po ba kayong mga questions po? Regarding the certificates, IDs. Yung certificates niyo po, kasama po sa package niyo po is digital copy only. If you want to avail hard copy of it po, you can avail po, pero may additional fee lang po na 100 pesos po if group of 10 participants po kayo na mag-a-avail. Kung isa lang po kayo mag-a-avail, 200 pesos po, pero free shipping na po yun nationwide.
Ma'am Joy?
Sir Mark, andyan ka na po.
I'm back na po, ma'am. Ayan, so yun guys, no, i-send ko na lang po yung link ng videos po natin kasi parang 5 minutes na lang po ang hindi po na napi-play. And for sure kasi putol-putol po. Nararamdaman ko na putol-putol talaga siya. Okay, let's have the advanced airway na po. Now, we have here the mga airway adjuncts po natin. Sulat ko lang ha, we have here the airway adjuncts. Now, when we say airway adjuncts po natin, so we have number 1, we have the OPA or the OPA. Next to OPA po, we have here the NPA or the Nasopharyngeal Airway Adjunct. Next po, we have here the BVM as part ng tinatawag na airway adjuncts po natin. So pag sinabi po nating OPA guys, Oropharyngeal, it's here the Oropharyngeal Airway Adjunct. And airway adjunct. Now, this is usually given po, especially if the patient is number 1, na unconscious talaga dapat. Why? Kasi syempre, pag oro kasi, sa mouth po kasi ang entry nito. In case po, pag conscious ang client po natin, you're going to stimulate the gag reflex. So baka masuka ang client po natin at baka na magkaroon pa siya ng tinatawag na aspiration pneumonia. Next to OPA guys, we have the NPA or known as the nasopharyngeal airway, ayan, adjunct po natin. Now, your NPA or nasopharyngeal airway adjunct, ayan, is usually given if the patient, ilong lang kasi ito naso. So, pwede siya sa conscious client. Aside sa conscious po, we have the conscious, patients po natin. So, we have the OPA, and then we have the NPA, and lastly po, we have the BVM. This is the bag, valve, and mask. Now, in handling the BVM, we have actually a technique here known as the E-C clamp technique. The E and C clamp technique po. So pag sinabi po nating E-C and clamp technique, look at me sa camera. Ayan, the C will be holding the mask, no? And then the E, yung tatlong fingers po natin will be lifting the jaw of the patient, and that is to maintain a patent airway. Kasi ang naman talaga natin, the goal here, aside from ventilating the client, we need to make sure na patent talaga ang airway, free from obstruction. So therefore, when we say airway adjuncts, these are usually given before intubating a patient. So it might be, let's say, sa case ni client, if you have an unconscious client, then you need to ventilate the client using that OPA before inserting the endotracheal tube. But then again, sino lang ba ang pwedeng mag-insert na endotracheal tube? Dapat doctors only and yung mga mga paramedics po. Nurses are not allowed to intubate a client. Kasi for nurses po, intubation now, hello jail tomorrow. Next. For NPA naman or the Nasopharyngeal Airway Adjuncts na given to conscious client kasi nose lang naman to or semi-conscious. However, kasi your NPA po, based sa video po natin, this is contraindicated if the client suffers from the basilar skull fracture. Kasi pag may skull fracture po ang client, mas lalo pong magkakaroon ng further damage na. And then lastly, we have the BVM. Now, the BVM guys, or yung mga commonly known as the bag po natin, the ambu bag. But then again, ambu bag is a brand name. We don't promote brands here. It's the bag, the valve, and the mask. And then ngayon, in the advent of your COVID, gagamit po tayo ng HEPA filter. Ipakita ko lang ang video ng HEPA filter po natin ha. For a while po. It's the HEPA. This is the setting up of the HEPA filter. For a while. O, di ba? Obvious naman, no? Kahit sa pag-load, guys. Wait lang. Ganito kabagal ang internet today. I hope mamayang 1 o'clock, okay na. Kasi parang nawawala na kasi ang ulan eh. Yeah. Pawala na po siya. Wait lang ha. Saan ba yung video po natin? Ayaw mag-cooperate. Sige, diretso na po ako. Ayan, sa BLS sequence po natin. Ayan, kasi this is actually the end of our BLS. And this is for the BLS sequence. Now, for the BLS sequence kasi, ito yung pagkakasunod-sunod ng mga discussions po natin. Let's say number 1. On the first arrival sa scene po natin, we need to determine for scene safety. This is number 1. You determine scene safety. Sir, how are we going to determine for scene safety? By looking up and down, side by side, top and bottom, diba? Ayan, check po natin talaga. Ayan, if there are no hazards po, upon checking for the hazards, there are no hazards present, then this is the time na to have the BSI. The body substance isolation po, as much as possible, dapat may full PPE po tayo. Ayan, again, the full PPEs na usually nasa either pag nag-work ka sa 911, paglabas mo pa lang sa ambulansya, naka-full PPE ka na. Pero let's say, kakalabas mo lang ng hospital at may nakita ka, well, hindi ka talaga maka-full PPE dyan. Ang importante lang is that before you start with your high-quality chest compression, you put a mask dapat sa client natin. Whether surgical mask pa yan, ang importante may mask talaga kasi hindi naman lahat po ay may N95 na mask. Okay? Aside from, putting your PPEs or your body substance isolation, this is the time that you're going to tap and shout. So tap, and shout. Dati kasi guys, upon tapping and shouting, to determine for the consciousness, let's say level ng consciousness ng client mo, to kasi yan, both hands dapat. Pero ngayon po, you're going to tap using one hand. And then wag mong ilapit yung mukha mo kay patient. And then, habang nagtatap ka daw, make sure yung ulo ng patient mo or the face of the patient must be facing away from you. Kasi pag start mo na mamaya ng compression, baka kasi, di ba, as we all know, your CPR kasi or high quality chest compression is an aerosol generating procedure. Pwedeng na ma-disperse po sa air ang tinatawag virus as high as 10 inches. So careful po tayo doon. So tap and shout. Sir, paano ba tayo mag-tap and shout? Hey, hey, are you okay? And then, hey, hey, are you all right? Are you all right? So again, hey, hey, are you okay? Hey, hey, are you all right? All right po. So in case lang na wala pa ring sagot si patient, meaning to say, okay, the patient is unconscious. Dapat sabihin mo dapat, the patient is unconscious. So, yun yung mark na magsa-start na talaga. So, meaning to say, you shout for help. This is the time na we are going to shout for help. Shout for help. Sir, paano ba mag-shout for help? So, help. Please activate. Please activate the emergency response system or the ERS. And you grab an AED. Guys, pag sinabi po nating AED, AED stands for what? The automated external defibrillator. It's the automated external defibrillator. Now, your automated external defibrillator is actually a walking and talking device. Siya po mismo magsasabi whether you have a shockable or a non-shockable na rhythm po. So, balikan natin. Number 1, you determine for scene safety. Checking for hazards. Ayan, if ever kung present po ang hazard, then do not start with your high quality chest compression, di ba? If the scene is not safe, you better stop. Kasi guys, number 1, if ever kung pupunta ka doon, magiging ikaw na naman ang patient, and then again, wala po tayong tinatawag na Good Samaritan law. Whatever happens to your patient, di ba, you are liable, and you're going to present yourself na po sa korte. Kaya nakakatakot sa Philippine setting. Pero pag sa Middle East, sa States naman po, may mga Good Samaritan law naman doon. So we're not liable kung anong mangyayari kay client. Pero pag sa Philippines, na-videohan ka na, nag-trending ka pa sa Facebook, and then you're going to present all the facts po sa court. Next, aside from determining safety, ayan, we need to wear your full PPE dapat ideally, and then we need to limit personnel. Limit po dapat ang personnel. Kasi pag madami ang tao, madami ding may expose. What if nag-COVID positive pala si patient? You tap and shout, hey, hey, are you okay? Hey, hey, are you all right? The patient is unresponsive. You shout for help. Help, please activate the emergency response system and you grab an AED. Simply, you call 911. If ever kung walang 911 sa inyo, 117 ata, depende po sa area. Alam ko kasi sa Bicol, 117 yan eh. Or, well, tawagin nyo na pinaka, yung iba kasi diretso na sa mga presinto kasi yung si presinto ng para magre-refer kung ano yung mga hotlines po natin, mga emergency hotlines. Ayan. And then aside from that, you're going to check for pulse. Check pulse rate and breathing. Dapat simultaneous na po ang pag-check ng pulse rate and breathing. Ayan, you're going to check for pulse. Look at me sa camera. Try kong i-on ang camera ko. Ayan. Check for pulse and check for breathing. Dapat ganun. Sabay dapat. Dati kasi, you check for breathing. 1,000 to 1,000. And then check for pulse. Ayan. So ngayon, sabay na po. Check for pulse and breathing. 1,000 to 1,000, 3,1,000, 4,1,000, 5,1,000. The patient has no pulse and is not breathing. I'm going to start with my high quality chest compression. So, ayan, no pulse rate and no breathing. So, start. This is the time that we're going to start high quality CPR. So, starting today, do not address that as your CPR. It should be high quality CPR. Lalo na if you're going to follow the protocols na po. Okay? So, ayan, this is the last na step and that is to start. Ayan, high quality chest compression. Since no pulse rate, no breathing po ang patient po natin. Questions? Questions? Before I present po our AHA 2020 guidelines. Ayan, guys, I'm going to present the AHA 2020 guidelines and the 2021 guidelines po, especially with COVID, updates po tayo. And then right after this, mag-aano na po tayo mag-quiz na, mag-exam na po tayo, BLS exam. And then we will resume at exactly 1 o'clock. Ako din yung mag-host po mamaya. Yeah, I'm praying na okay. I-reset ko talaga to. Gagawin ko na lahat para ma-okay yung internet ko mamaya. Okay, so we have the adult, latest guideline. This is based on AHA, guys. Ayan, I'd like to emphasize na ang sabi dito, aside from verifying scene safety, you don PPEs, full PPE tayo. And then you limit personnel. Kasi, pag more personnel po tayo, more exposure po tayo, more chances of winning. And then if you're going to make use of the BVM, dapat using filter and tight seal po tayo. Meaning to say you're going to use the HEPA filter. Mamaya, may video po tayo regarding HEPA filter. So far, yan lang naman yung binago nila as part ng guidelines po. And then, yung pag-tap ng shoulder, dapat hindi dalawang kamay. Dapat, kasi di ba pag dalawang kamay, hey, so both shoulders pa, medyo lalapit ka talaga kay client. So away dapat pa rin kay client using your one hand. Tap lang yung nearest shoulder na part ng body po. So nearest you, so dapat itap mo lang, hey, are you okay? Hey, are you all right? Huwag nang ilapit ang mukha, utang na loob. Kung gusto mong ma-COVID pues, ilapit mo yung mukha mo. Na part ng protocol na ngayon na dapat you cater everyone as contagious po, na dapat extra cautious po tayo kasi halos lahat ng papasok sa ER na dapat always na bear in mind dapat na baka positive to. So at least may safety pa rin, 'di ba? Ayan, that's for adult client. For pediatric naman, the same pa rin. Donning your PPEs po, limit personnel using the filter known as the HEPA filter. Airtight seal tayo because this is an aerosol generating procedure. Kaya careful pa rin po tayo. Now, for my last videos na po, I will be showing aspiration. And aside from that, yung ating, saan na ba yan? Yung HEPA filter po natin. For a while guys ha, hanapin ko lang si HEPA filter. This is the setting up of your HEPA filter. This one. Okay, full volume po tayo, please.
Building a bag valve mask setup intended to decrease the amount of virus in the air. What we need for this is our mask, we need a PEEP valve, our bag, and we need a viral filter. So these are 3 viral filters, 2 different brands. These 2 have a bonus humidifier in them. We can use any of the 3. So we'll take our mask, we'll connect the viral filter directly to it. Next, we will connect our Untitled CO2 sampler, and we'll connect the bag to that. Now we'll take our PEEP valve and we'll connect this to the exhalation outlet. Now that we have this all connected, we have a viral filter connected directly to the mask, and this will effectively separate inhalation and exhalation so that on inhalation, oxygen flows from the bag and the reservoir into the patient. On exhalation, it flows in this direction. The PEEP valve, as we have it, is set to 0. When it's set to 0, it acts as a one-way valve, so it effectively separates inhalation and exhalation and can be used to pre-oxygenate the patient in place of a non-rebreather mask or other mask.
Okay, that's for the setup ng ating HEPA filter. Guys, ngayon kasi, in the advent of COVID po, may ginagamit kasi ngayon known as the Lucas device. Si Lucas device po is actually parang na siya, machine na po siya na kung saan siya na po mismo magko-compress. Kasi we need to limit exposure kasi sa ating patient.
The battery indicator
This
on
is
the
Lucas device.
This is an instructional video on how to use the Lucas machine. The Lucas machine is a device useful to delivery of external chest compressions to a patient in cardiac arrest, especially during extended CPR when fatigue may prohibit the delivery of effective compressions to the patient. To remove the Lucas from the box, unzip box and remove the backboard from the lid section. Correctly placing the backboard. Lift the patient forward with 2 staff or roll to the side. Slide the backboard under the patient and lay the patient down. Ensure the backboard lies along the lower third of the sternum. Lift the patient's arms up and place alongside the head if possible. The back plate will be up near the patient's armpits. Ensure the Lucas machine can be clicked into place and the arms are out of the way. Considerations are the width of the patient. Will the machine fit over? Is the patient too large? The upper part of the machine will not click into the back plate. If this is the case, immediately resume manual chest compressions. Removing the top part of the Lucas from the box. Lift Lucas out of the box with the heavy end nearest to you. The machine is top heavy, so beware of the weight distribution as you lift. Pull the release rings once to make sure the claw locks are open and let go of the release rings. Place the Lucas over the patient and click into place. Click one side in first, then the other. Ensure an audible click is heard and check the machine is secure.
Make sure the lower edge of the suction cup is immediately above the end of the sternum. If necessary, move the device to adjust the position of the backboard. Turning the machine on. Press and hold the on-off button to turn on. Setting the suction cup. Pull the suction cup down to touch the patient's chest. Push the 2 pause button and the device will lock the correct start position. Choose 30 to 2 or continuous, whichever is appropriate for your resus situation. If 30 to 2 has been selected, the machine will deliver 30 compressions. Listen for the beeps to alert when the machine is stopping for a ventilation pause. At the end of a 2-minute cycle, press the pause button to stop chest compressions to allow analysis of the rhythm. To restart, press play. The battery indicator on the top shows red, amber and green lights to indicate battery level. Connect to mains power if possible when in use. A fully charged battery lasts for 45 minutes. The low battery alert is a flashing yellow light. If the battery gets too low, the device will stop. If this happens, resume to manual chest compressions. When the machine is plugged into the mains power, it should take 2 hours to fully charge. Please leave on charge when not in use. To remove the machine, press 1 and lift the suction cup away from the patient. Press and hold the on-off button to turn off. Lift release clips and unlock the device from the backboard. Before placing the Lucas machine back into the box, ensure the suction cup has been removed and disposed of. Clean the machine down with Clinell wipes. Ensure a new suction cup has been replaced and it is ready for next use. The backboard slides into the lid. Ensure the device is placed back on charge. The charging cable socket is on the back of the box, as demonstrated. We hope you found this video useful. Please contact your site resus.
That's the Lucas machine chest compression system. So meaning to say, it's a battery operated pa rin po. So if ever kung hindi siya na-charge, malamang hindi talaga siya gagana. So mas maganda pa rin guys na ang mga human efforts pa rin po. No? Kasi mas passionate siya eh. Kung i-compare po natin sa device na yon. And yeah, may mga naririnig na ako ng mga hospitals po ng Manila na may mga Lucas machine na po. Okay, this will be our last topic now for our BLS, and that's the saan na ba yun? Airway lang ha. Okay. Ma'am, may mga announcements po ba tayo, ma'am? Wala na, ma'am, no?
Yun po, yung mga hindi pa po nakakasend ng mga names nila po and email, pakisend na po ng email nyo po and yung names para magawa na po yung certificates nyo po. And again po, sa mag-a-avail po ng hard copy, meron pong additional fee na 200 pesos, free shipping nationwide na din po yun. Kung 10 participants and above po kayo, 100 na lang po. Basta one address lang po.
Thank you, ma'am. Let's play na po the choking. Ayan, video po natin.
Well, hey, Scott.
Hey, Sam. How you doing?
I'm looking forward to a few days of not being on call.
I didn't think you ever needed rest.
Oh, I'm not resting. I've got my whole family coming into town this weekend, and they're expecting me to provide the entertainment. What's wrong?
I think he's choking. Are you choking? I'm gonna help you. Sit down, sit down.
Choking occurs when food or other items block a person's airway. In severe airway obstructions, the victim usually will have signs of poor air exchange and breathing difficulty, such as a silent cough, cyanosis or turning blue, and an inability to speak or breathe. The adult or older child may clutch the neck with both hands, making the universal choking sign. This is a signal to ask if the victim is choking. If the victim nods that he or she is choking and cannot talk, you must act. In a standing or kneeling victim, you'll perform an abdominal thrust, often referred to as the Heimlich maneuver. Stand or kneel behind the victim and place your arms around the victim's waist. With one hand, locate the navel. Then make a fist with the other hand. Place the thumb side of your fist against the victim's abdomen, just above the navel and below the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. If the victim is too large for you to wrap your arms around the waist, pregnant or overweight, for example, wrap your arms around the victim's chest and do chest thrusts instead of abdominal thrusts. If your attempts to relieve choking in an adult or child are unsuccessful or the victim becomes unresponsive, send someone to activate the emergency response system. Perform CPR using the CAB sequence with one exception. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it, but do not perform a blind finger sweep as the object may become lodged further back in the airway. Choking is also a fairly common emergency among infants. The steps to relieving choking in an infant are quite different than those for older children and adults. If you find an infant choking and they are responsive, first sit or kneel with the infant in your lap. Hold the infant face down with the head slightly lower than the chest, resting on your forearm. Support the head and jaw with your hand. Avoid compressing the soft tissues of the infant's throat. Rest your forearm on your thigh to provide support. Deliver up to 5 back slaps forcefully between the infant's shoulder blades using the heel of your hand. Deliver each slap with sufficient force to attempt to remove the foreign body. Then place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck. Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts the same way you perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at a rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or the infant becomes unresponsive.
Ayan. Hello po. So let's have the online open forum na po tayo. So you can ask questions and regarding sa ating BLS. Pa-on na lang po ng mga nila, ng mga cameras po para at least makita ko yung trainees po natin. On na lang po ng mga cameras. Yan, let's have the question and answer portion na po. Guys, pa-on na ng mga cameras nila. And then we will have the pictorials na din. Para matatag po kayo ng WIPOM, tapos ma-check po ng mga kasamahan po. Tapos may issue agad kayo na, hala, buti pa siya updated. Buti pa siya nagjo-join siya ng training. Competent nga siya. For a while, may screenshot lang tayo. Questions? Ba't hindi ako makakapag-screenshot? Questions po? May mga katanungan po ba? And Ma'am Joy, okay lang pa screenshot tayo, ma'am? Hindi ako nakakapag-screenshot. May problema ata. Questions po? Dito na lang ako mag-screenshot sa ana. Oh, 1, 2, 3, smile. Next panel. Oh, 1, 2, 3, smile. Next panel pa. 1, 2, 3, smile. Ayan. So guys, BLS kasi medyo basic pa siya, no? And then, ma'am, let's say tomorrow po, at exactly 8 o'clock, yun na yung medyo mas mabibigat na ng mga topics such as ECG, pharmacology. So if ever po, kung naka-enroll ka sa BLS only, pwede ka naman mag-join tomorrow. However, wala kang tama ba ako, ma'am? Wala siyang certificate. So it's up
Yes,
to you
sir.
kung magde-decide ka na na mag-avail po. So sayang lang din, 'di ba? Certificates lang naman talaga ang pinaka-importante din sa lahat po. Like for accreditation, 'di ba? Let's say kung gusto mo nang mag-abroad, no? Ayan, kailangan po ng certificates. Questions? Pasensya na, I'm using the logo of our school. I'm a full-time kasi na clinical instructor ngayon. Nung nag-pandemic kasi guys, clinical instructor ako ng San Pedro College, Davao City. Pero before pa nag-pandemic, I'm a full-time national reviewer.
Sir Mark, nawala ka po. Hello, Sir Mark. Nawala si Sir Mark. Na-disconnect ulit si Sir Mark. Yan po, sa mga BLS only po, kasi meron po ata tayo ditong 15 participants ng BLS only. If you want to upgrade po into ACLS and phlebotomy, you may attend po, ha? Pwede po kayo mag-attend kung gusto niyo mag-upgrade. Pero kung ayaw niyo po mag-upgrade, pwede pa din po kayong mag-attend. Okay po? Pero wala lang po kayong certificates, syempre. Yan. Tapos, for example, gusto niyo po mag-avail ng ACLS certificates next week kasi kulang sa budget, pwede naman po. Basta mag-attend na po kayo ngayon. Walang problema po yan. At least additional knowledge po. Yan. Meron po kayong questions po kung nahihiya pong magsalita, pwede po sa chat box habang hinihintay po natin sa Sir Mark. Pasensya na po, medyo unstable yung internet connection ni Sir Mark. Yan. By the way po, sa mga hindi naka-attend today, kasi for sure yung iba dyan on duty or from duty, pwede po ulit kayong mag-attend sa next schedule po natin ng ating BLS and ACLS. Meron po kaming next schedule on September 30. On September 30, it's a one-day only BLS and ACLS. If you want again to attend, pwede po kayong mag-attend para po ma-refresh or yung iba hindi nakaka-attend ngayon masyado dahil sa internet connection. Pwede po kayo mag-attend sa next schedule. September 30, 6 a.m. po ang start nun, 6 a.m. Actually, in-house po itong training from Tri-City Hospital. Pero pwede po kayong mag-sit in sa ating pong session on September 30. Wala po yun additional fee. Okay po? Sir Mark, are you there po?
Yes, ma'am.
Nawala ka ulit, sir. Yes.
Oo nga, ma'am.
Ang
Wala.
huli namin narinig, national lecturer ka.
Yun. Ayun, ma'am. So, done na po kami sa BLS, ma'am. Bale, mag-exam na po sila, ma'am.
Yes
And
po.
then, resume po at exactly 1 o'clock.
Okay.
So,
Okay.
bye for now.
Isasend po-
Thank you po sa aming BLS only. I hope po na magjo-join pa po kayo and ma-encourage po kayo na mag-join pa talaga sa aming sa aming ACLS. Kasi if i-weigh talaga natin, no, ang pinaka-heavy talaga na will be the ACLS. Kasi it's more of pharma, it's more of medication, and it's more of ECG analysis. And then mamaya po, gagamit po kami tomorrow po, gagamit kami ng mga DART simulator. Ipakita ko lang para mas ma-excite naman po yung yung mga mag-ACLS po tomorrow. So ganito ang mangyayari, guys, that you will be analyzing a scenario. Yeah, so like for example, ganyan ang scenario. So tomorrow, ipapa-identify ko yan sa inyo. So you're going to tell me the heart rate now of the patient. So the heart rate is 38. The rhythm is regular. I can see P waves. They're clear and upright, followed by QRS, which is normal. So therefore, the patient here is suffering from sinus bradycardia. So ano bang iti-treat natin? No? Or let's say, ano ba ang gagamitin natin as treatment or management po based on the AHA 2021 guidelines or protocols po natin. So, yun po. No? So, I hope na mas may encourage pa yung nag-BLS only lang. So, for the ACLS naman po, try to scan na your manuals because we will be including na yung mga AV blocks po natin tomorrow and their treatment and their management po. So, guys, nakalagay na po na yung BLS exam natin. Ma'am Joy, I'm done na po with the BLS.
Yes, sir. Thank you so much, sir. See you later at 1 p.m. po for our seminar.
Thank you, ma'am.
Guys, na-send na po sa chat box yung BLS exam. Sa mga BLS only po, pakisagutan na po ito. Again po, pakisave na po nitong link ng BLS exam kasi pag na-disconnect po kayo dito sa Zoom, mawawala po lahat ng conversations natin po sa group chat. Okay po, paki-save na po ng BLS exam link. Again po, yung mga names nyo po, pakisend po to everyone or to WePump admin para po mabasa po ng WePump admin yung names niyo po for the certificates po. Any questions so far? Sa ating lecturer and sa ating
So far,
admin
kanina,
po.
ma'am, wala naman daw, ma'am. Siguro baka tomorrow pa yan sa ACLS.
Opo. Yan, again po sa mga BLS only, after the exam po, and kung nakasan na po kayo ng names niyo po for the certificates, kung ayaw niyo pong mag-attend later, pwede na po kayo mag-leave, we're done na po. Pakihintay na lang po ng mga certificates and IDs niyo po through your email, contact number, or your Facebook Messenger po. Di ba po, upon reservation, hinihingan po kayo ng email and contact number. Doon po namin isa-send po yung certificate niyo po. And regarding sa official receipt niyo po, kasama na po yun sa Google Drive na isa-send po namin sa inyo with your certificate. Ano po yun? Ma'am Rhea? May questions po, Ma'am Rhea? Wala po ata. Yan. Meron pa po bang questions? Kung wala na po kayong questions, I'll be playing videos po as a recap for the BLS po. Okay po?
Jason, can you hear me? Oh, no.
What's the address of the emergency?
Press 50 Wheeler Road, Oakdale.
LFA Station 1, Medic 5, possible cardiac arrest, 50 Wheeler Road, across Millard.
And is he breathing?
No, he's not breathing. Please help.
Dispatch LFA engine 105 is route 50 Wheeler Road.
50 Wheeler, data on patient, 60-year-old male, bystander service in progress.
Copy. CPR in progress.
Go ahead and set your phone down. Put me on speaker.
Hold on. Yes.
Okay, let's get him flat on his back. I'm going to tell you how to do CPR. Okay, I want you to put one hand on top of the other right in the center of his chest. Chest, hard and fast, at least 2 times per second and 2 inches deep. We're going to do this 600 times until help can take over.
Okay.
This is the pace that I want you to do. It's 1, 2, 3.
Dispatch. LFA Command 2 en route. I'm mobile and nearby. ETA 1 minute.
Cardiac arrest is the loss of the heart's ability to pump blood through the body. The most dramatic occurrence, sudden cardiac arrest, can happen anywhere with little or no warning. Victims unexpectedly collapse. Breathing stops. Sudden cardiac arrest occurs when the normal electrical impulses in the heart suddenly become disorganized. Normal mechanical contraction of the heart muscle is lost, and a chaotic quivering condition known as ventricular fibrillation can occur. Blood flow to the body, along with the oxygen it carries, abruptly stops. Within minutes, brain cell death starts to occur from the lack of oxygen.
In here. Okay, thank you.
Sir, are you okay?
Confirm cardiac arrest.
Cardiopulmonary resuscitation, or CPR, is the immediate treatment for a suspected cardiac arrest. CPR can restore limited oxygen to the brain and other vital organs through a combination of chest compressions and rescue breaths. However, CPR alone is not enough.
1, 2, 3, 4, 5, 6.
The most effective way to end fibrillation is defibrillation, using a defibrillator and electrode pads adhered to the chest. A controlled electrical shock is sent through the heart to stop ventricular fibrillation, allowing the heart's normal electrical activity to return and restore the normal pumping action of the heart. Successful defibrillation is highly dependent on how quickly a shock can be delivered. For each minute in cardiac arrest, the chance of surviving goes down by about 10%. After as few as 10 minutes, survival is unlikely. An automated external defibrillator, or AED, is a portable, computerized device that is simple to operate. The use of AEDs by emergency responders and other healthcare personnel allows defibrillation to occur much earlier than before. Turning on an AED is as simple as pushing a power button. Once on, an AED provides voice instructions to guide an operator through its use.
Apply pads to patient's bare chest.
An AED automatically analyzes the heart rhythm to determine if a shock is needed.
Stay clear of patient. Analyze it.
If a shock is advised by the AED,
Shock advised.
Everyone clear?
the operator clears the person and pushes a button to deliver the shock.
Shock delivered. Begin
Immediate
CPR.
high-quality CPR and early defibrillation with an AED can double or even triple the likelihood for survival. Most cardiac arrests occur outside of a hospital. Most of those occur in the home. The chain of survival is often used to describe the best approach for treating cardiac arrest. Each link in the chain is essential for a person to survive. If a single link is weak or missing, the chances for survival are greatly reduced. The greatest chance for survival exists when all the links are strong. The chain of survival for cardiac arrests outside of a hospital consists of 5 interdependent links. Early recognition of cardiac arrest and prompt activation of the emergency response protocol for the setting. Immediate CPR with high-quality chest compressions. Rapid defibrillation or electrical shock to the heart. Effective basic and advanced EMS care and transport, and effective post-cardiac arrest care at a hospital. Cardiac arrest inside a hospital usually occurs when a known medical condition worsens. The chain of survival inside a hospital reflects how resuscitation fits into the overall picture of medical care. Monitoring, prevention, and treatment of pre-arrest conditions. Early recognition of cardiac arrest and prompt activation of the emergency response protocol for the setting. Immediate CPR with high-quality chest compressions, rapid defibrillation or electrical shock to the heart, and effective post-cardiac arrest care.
Engine 2312. Dispatch, engine 2312, on scene now.
I just got him out. Sir, can you hear me?
Unlike sudden cardiac arrest, in which the heart is the primary problem, cardiac arrest can also be the end result of a blocked airway or loss of breathing. This is known as secondary cardiac arrest.
Apply pads to patient's bare chest.
Problems such as hazardous breathing conditions in a confined space, drowning, and drug overdoses are all causes of secondary cardiac arrest. With no incoming oxygen, the heart progressively becomes weaker until signs of life become difficult or impossible to assess.
Stay clear of patient. Analyzing. Stay clear of patient. No shock advised. Begin CPR.
Medic 849, engine 2312.
If the heart is simply too weak to create obvious signs of life,
Cardiac arrest.
immediate CPR with an emphasis on effective rescue breaths may be the only chance to restore them. The abuse of opioid drugs is a serious and growing health problem. Increasing prescriptions for opioid pain relievers such as hydrocodone and oxycodone have made them more commonly available. The increased availability and use of heroin, a highly addictive opioid, is also contributing to the problem. As a result, overdoses and deaths from prescription opioids and heroin have risen dramatically. Opioids taken in excess can depress and stop breathing. Opioid overdose is a common cause of secondary cardiac arrest. Suspicion of opioid use may present itself through questioning of bystanders or by observation of the person and location in which she was found. Naloxone, also known as Narcan, is a medication that can temporarily reverse the life-threatening effects of opioids. It's easy to administer, either through an auto-injector device or through an aerosol that is sprayed into the nose. Initiate and establish BLS care prior to using naloxone for suspected opioid overdose.
You hear me? Hello? Hello? Man, this is engine 105. We have a child in cardiac arrest at our location. We need a medic unit right away. Copy that.
Children are more likely than adults to experience secondary cardiac arrest due to an airway or breathing problem. Describing age groups in relation to CPR, an infant is younger than 1 year of age. A child is 1 year of age until the onset of puberty. Puberty can be identified by breast development in females and the presence of armpit hair in males. A person is considered an adult after the onset of puberty. The chain of survival for children and infants emphasizes prevention and giving effective rescue breaths as part of CPR. Prevention of airway and breathing emergencies. Early CPR with an emphasis on effective rescue breaths. And if needed, defibrillation with an AED. Prompt activation of the emergency response protocol for the setting. Effective basic and advanced EMS care and transport. And effective post-cardiac arrest care at a hospital. Quality of CPR matters. Higher quality CPR performance is directly related to an improved chance of survival. There are two key elements of high performance CPR: high quality CPR skills and a more efficient team approach to resuscitation. CPR skills can vary greatly depending on a person's experience, practice, and physical ability. It is normal for there to be a gap between perfect skills and what you can actually perform. An important goal is to narrow that gap as much as possible. High-quality CPR skills include beginning CPR compressions within 10 seconds of determining cardiac arrest, compressing fast at a rate of 100 to 120 times per minute, compressing hard, at least 2 inches on an adult, and at least 1/3 the depth of the chest for children and infants. Allowing for complete chest recoil at the top of each compression, minimizing interruptions to compressions. Giving effective rescue breaths that create a visible chest rise. Breaths that create a visible chest rise. And avoiding excessive air on rescue breaths.
Sorry everyone, unstable po yung internet connections ko. Actually, I'll using PLDT Converge and DCTV pero lahat sila ngayon may problem. If you want the videos po, you can ask the admin na lang po sa page po para may provide po yung videos. Yan. By the way po, may questions pa po ba bago ko po i-end itong Zoom meeting na to? Meron na po ba kayong copy ng exam? I-resend ko po ulit yung copy ng exam. Yan. Again po, pag done na po kayo sa exam, lalo na sa mga BLS only, dapat po na-send nyo na rin po yung names nyo po and yung email and yung training po na inattendan nyo po. Kung BLS alone, BLS-ACLS and BLS-ACLS phlebotomy. For batch 84. Batch 84 na tayo po through online. Yan. Kung meron pa po kayong ibang questions, feel free to message the page po para ma-assist po kayo ng mga coordinators and admins natin po. Yan. At exactly 11:25 po, i-end ko na po itong meeting natin po. Itong Zoom meeting natin po. And i-on ko na po yung Zoom meeting for the seminar po at exactly 12 noon. Yan. 100 participants lang po ang kayang i-accommodate ng Zoom meeting natin po for later. Kaya kung hindi po kayo ma-accommodate, naka-live naman po tayo through Facebook account natin. We Pump Center for Learning. Pa-search na lang din po and pa-follow para makapanood po kayo and maka-avail din po ng certificate nun. And kahit po naka-Facebook live lang po kayo, pwede po kayo maka-avail ng certificate. Any questions so far po before I'll end this meeting? Usually po ang BLS-ACLS and phlebotomy namin po is 1.5 day lang po siya. Kaya nga po siya in 1 day. Kaya meron po kaming schedule on September 30 for the BLS and ACLS. Pero 12 hours po namin yung gagawin. Pero ngayon po mag-extend po tayo. Kaya bukas po whole day po tayo until phlebotomy. Kasi po meron po tayong free seminar this afternoon. Hindi ko lang po alam kung until what time po yung seminar for today. Depende na po yun sa instructor, sa speaker po natin. Yan. At sa 11:20, I'll end this Zoom meeting na po. Make sure po na save nyo na po yung Zoom link for the seminar later. And again po, tomorrow or after the seminar po, depende po kasi kung maaga matapos, magkukontinue po tayo ng ACLS po natin. Start na po tayo ng ACLS, ECG reading and pharmacology. Yan. Pero po kung abutin po tayo later ng 4 p.m. onwards, tomorrow na po tayo mag-start ng ACLS po natin. Make sure po to double check your names, the spelling. Kasi once po na nagawa na po yung certificate and IDs, lalo na po sa ID, may additional fee po pag inulit po. Kasi po binabayaran po namin yan. IDs. Any questions so far po? 2 minutes left po for the questions before I'll end this Zoom link. Again po, invite niyo po yung colleagues niyo po to attend para mamaya po Again po sa mga unstable ang internet connection, sa mga hindi naka-attend, while sa mga on duty and from duty na hindi po naka-attend, pwede po ulit kayo mag-attend on September 30, 2021, 6 a.m. Hingi na lang po kayo ng Zoom link sa ating page po para makapag-attend po ulit kayo ng training. It's 12 hours training, BLS and ACLS. Wala na po yung additional fee. Attend lang po kayo. Iba po yung instructor natin on September 30, si Doc Ted. So kung gusto niyo yung ibang approach naman, pwede po kayo mag-attend. I-end ko na po tong Zoom meeting. Enjoy your lunch. See you at 1 p.m. Thank you so much.